I'm getting tongue-tied saying it. Let's bring in Dr. Susanna Hills to talk more about this. She's a board-certified pediatric ear, nose, and throat doctor and airway surgeon. So I got to tell you, I had actually never heard of tongue-tied or tongue tie in newborns, but I'm really glad we're talking about this because I feel like sometimes new moms really feel sort of pressure to get this breastfeeding thing right and for it to come naturally. And if there are any hiccups, they blame themselves. So it's good for them to know that, you know, there are things out there. So what is tongue tie?
Yeah. So a tongue tie is an anatomic situation where the band under the tongue, it's called a frenulum. It's a normal piece of anatomy, but it can be a little bit tighter in some babies. We talk about this a lot, especially in the newborn nursery, because just as you said, it's really stressful to try to start breastfeeding. It is actually kind of normal to have it a little bit of a difficult time at first and to have to work at doing it. It's not an easy thing. And so there are a lot of questions about, does my baby have a tongue tie or not? And it is something that is really easy to repair if it's an issue. It's just a matter of looking for it, noticing it, and then figuring out, is this a normal band or is it something that is making the tongue tighter and something that we need to actually address?
How would you notice it? I don't think we showed a picture. So you're talking about sort of a little bit of flesh that's like underneath the tongue, right?
If you look in the mirror and lift up your tongue, you can see that band there. And sometimes in some kids, it goes all the way out to the front of the tongue.
Wow.
So when they try to stick their tongue out, it looks like a little heart because the front of the tongue is kind of held back. The other thing to notice in kids is that sometimes the lip is stuck down too. That band under the lip can be thick. That's really has an important effect on breastfeeding too. If it's too tight, it can really make it hard.
So I'm guessing the procedure to correct that is a fairly simple one for a surgeon like, because I mean you circumcise us, so like I mean I figured it's got to be got to be a more painful procedure.
Right.
All roads lead back to something that Vlad can identify with.
Well, that's how I think that everybody identifies with the news, right? I mean, I was just thinking to myself, this has got to be a pretty easy procedure because when babies are born, you clip the umbilical cord, you do all sorts of things. This is just another one of those.
This is another like bedside procedure. You're exactly right. That can be done in a newborn. Right.
Yeah.
It's a very straightforward thing to do. And the way I usually explain it to moms, just to bring it to something they're familiar with, is it'll usually feel a little bit like a vaccination. They'll react like getting a shot in the sense that it's, you know, I will do it in clinic in kids who are under 4 or 5 months old just with a simple scissor. It's just a quick cut and it's done, and it doesn't require anesthesia. Insurance will cover it. It's a very straightforward thing to do.
But it won't correct itself on its own?
So it won't correct itself on its own in the sense that the band won't go away. But there are some kids who have a short frenulum. They may look like they have a tongue tie, and they may do great with breastfeeding. In that case, is it really necessary to do anything procedural? Maybe not.
So are we seeing an increase in this? I guess, is there an increase in it, or are we seeing an increase as more people try to breastfeed? Is it something that you might not notice if you didn't do a lot of breastfeeding?
That is a question that I'm thinking about a lot right now. In this moment with the formula shortage, just to add another layer of stress, you know, our parents also they're having to try to breastfeed. I'm wondering if I'm going to see in my clinic more patients who are looking for things that might help with breastfeeding. Does my baby have a tongue tie? And so we'll see what happens over the next few weeks. I don't know that we've seen a true uptick in the number of referrals at this point. What I have seen is kids of mine who are on specialized formulas who have had a tremendous amount of trouble getting a new formula, switching in the formula shortage. And I'm seeing families who don't have resources to buy excess formula or to hoard, families who need WIC, who use food stamps, who don't have the resources to drive around to 10 different supermarkets trying to find formula.
But Dr. Hills, I don't know if we ever came up with I think we were talking about doing some research on our own about this, but what did we do before the invention of formula? You know, I mean, for thousands of years, humans babies have been born and have grown up, and formula is like an 80-year thing, right? Totally,
yeah. Well, just remember, though, that the infant mortality rate was way higher.
Oh, right. You talked about midwives, didn't you?
Well, I talked about wet nurses. But that was really for sort of wealthy people. But, I mean, I have since seen, like, all these sort of grandma's formula, you know, with carnation, all kinds of crazy things that people said, well, my grandma said that that's what they used to do before formula, and to your point, that wasn't the good stuff.
That's
right?
Not good
yeah, no,
making your own is not.
No, it's not right. It's not safe. It doesn't have the right balance of hydration, water, nutrients. getting too much water in your baby can be a fatal problem because their kidneys aren't designed to filter that much water. It can cause, if you get an electrolyte imbalance, then you can have a child, an infant that develops seizures. It's really dangerous, actually. And home formula is much more prone to these bacteria that might be harmless to us, but in a newborn immune system that's not fully developed, they can be really dangerous. But I love that you just brought up wet nurses because, in fact, that's a strategy that was used all the time before. We're still kind of using it in the sense that there are breast milk banks all over the place. And that's something that a lot of parents struggling to find breast milk don't know. So ask your pediatrician. That's another resource just to think about. By the way, look for the breast milk banks to get breast milk if you need.
I was thinking that they're probably going to be in high demand now. You know, they were already, you know, there's not a lot of them out there, but it is an option for people who really are in need.
Fascinating discussion. Dr. Hills, great to have you in studio. Thank you very much.
Great to be here. Thank you.
It's good to see you.